তার জন্য একটা অ্যাকসেপ্টেড মেথড। বেসিক্যালি বলতে গেলে এটা খুবই এফেক্টিভ একটা মেথড। এখানে তোমরা দেখতে পাচ্ছ সি শেপের এখানে একটা স্ট্রাকচার আমাদের করা হয়েছে। এখানে কারা থাকে? প্যানেলিস্টরা থাকেন। প্যানেলিস্ট মানে যারা ডিসকাস করেন, ঠিক আছে? চেয়ারপারসন থাকবে, মডারেটর থাকবে। তাদের ফাংশন কি? তারা পুরো জিনিসটাকে কোঅর্ডিনেট করেন। বোঝা গেল? এবার প্যানেল ডিসকাশন আমরা কখন করছি? তোমরা থাকছো অ্যাজ অডিয়েন্স। যখন একটা সেশন আমরা কনক্লুড করব, যিনি মডারেটর তরফে মানে প্যানেলিস্টের তরফে উনি জিজ্ঞেস করবেন এবং আমরা সেটাকে এক্সপ্লেন করব। ঠিক আছে? প্যানেল ডিসকাশন যখন আমরা করি, বেসিক্যালি ধরো কোনো ইম্পর্টেন্ট টপিক, কোনো অ্যালার্মিং ইস্যু, সেগুলো নিয়ে প্যানেল ডিসকাশন করা হয়। যেমন ধরো রিসেন্ট ডেজে তোমরা দেখছো বাজেট প্রেজেন্টেশন, তোমরা যদি খেয়াল করো ইউটিউবে বলো বা তোমরা টিভিতে বিভিন্ন নিউজ চ্যানেলে দেখবে এরকম সি শেপের বসেন এবং যিনি নিউজ রিডার থাকেন তিনি কিন্তু মাঝে থাকেন। অনেক তরফের মধ্যে নিজেদের মধ্যে ইন্টারাকশন হয়। কেন হচ্ছে? কারণ রিসেন্ট ডেজে কার কি ভিউজ ওই পার্টিকুলার টপিকটা নিয়ে, তার জন্য ওয়ার্ল্ড ক্যান্সার ডে। সেক্ষেত্রে আমরা আমাদের সেশনটা স্টার্ট করছি, আমাদের মডারেটর ইনিশিয়েট করবে, দেন আমাদের একে একে ইন্ট্রোডিউস করা হবে। থ্যাংক ইউ।
So, today we have organized a panel discussion on cancer and its management, where we will discuss about different type of cancer, their symptoms, clinical manifestations, and prevention and management. I would like to request the moderator of today's panel discussion would like to introduce and welcome my panelists. I am privileged to welcome Dr. Helen Maria Dos, Principal of College of Nursing, Kalpana Institute of Nursing, also Chairperson of today's panel discussion. Madam Shukonya Chaudhary, Lecturer, Kalpana Institute of Nursing. Madam Shrestha Shai, Lecturer, Kalpana Institute of Nursing. Madam Kolpita Bosher, Lecturer, Kalpana Institute of Nursing. Madam Shreya Ghosh, Sister Tutor, Kalpana Institute of Nursing. Madam Sanjita Yasmin, Sister Tutor, Kalpana Institute of Nursing. Thank you, ma'am. Now, I am privileged to hand over the microphone to Chairperson, Principal ma'am, to start today's panel discussion. Thank you.
Thank you. I'm a chairperson of this. Dr. Helen Maria Das, chairperson of this panel discussion. I would like to introduce my panelists. We have Ms. Suganya, lecturer, Community Health Nursing Department. She is going to talk about the breast cancer. Yes, next will be Shrestha. She will be talking about the cervical cancer. And Ms. Kalpita, she will be talking about the oral cancer. And Ms. Sanjita will be the lung cancer. She will be talking about the lung cancer. And will be Shreya, she will be talking about the colon colorectal cancers. Okay. So, I think you are audible without mic, right? Yes. So,
See, with this small 3 minutes, you might have understand how we have organized the panel discussion. If you could see how we have organized, before that we have to select the topic that madam is explaining in Bengali. So I am just explaining in English. Select the topic, it should be a hottest topic. Then you have to select the panelist. Discuss about this. Then you have to arrange the hall arrangement. While arranging the hall arrangement, you take one board and write about the panel discussion and what is the topic and moderator. Moderator is the person who is introducing. You might have seen I am a moderator. She is the one, Bolumi, who is standing in the dais. In the one. So she is introducing and she is welcoming all the panelists and we are coming and taking our seat. Then she is handovering the session to the chairperson. So I am the chairperson. I introduce. I am so and so. I am going to talk about this and this chairperson should have a wide knowledge. She should talk about the statistically what are all the problems because this panel discussion is a higher level learning. So one more thing, we are going to discuss among the members, chairperson and the panelist. Audience have only passive listener. Audience time will be given at the end of the session, that I will tell you. So once moderator hand over the session to the chairperson take it and introduce what topic they are going to discuss about. Each one I have introducing. Then I am starting with the introduction, and then I am linking with the audience whom I have to linking with the panelist, and the panelist will be discussing. No panelist will be contacting directly to the audience. So the chairperson's main role is she has to be control the groups, and she has to motivate this one. No fight. The deviation should be avoided. The topic should not be deviated from the another one. She should see that within the territory of the topic it should be discussed. Moderator will be watching throughout. The time management and other things will be watched by the moderator. If so much it is exceeding, she will come and tell the chairperson to control it. So each panelist will be having a discussion without any fight or something. So where and all you can conduct the panel discussion? You can conduct in the hospital setup. You can call the doctors, and infection control nurse can be joining, and all the HOD of the departments, and they all can sit together how to reduce the hospital infections or nosocomial infections. Then they can put one panel discussion in the conference session or something, and in that they can tell their lived experience. Like for example, nosocomial infections or the hospital infections are how the nurse has been put or anything uncovered syringe or something, how the fourth class worker got injured and his ignorance, how it end up with the diseases and how you have prevented. For example, or the housekeepers when they are cleaning, the signboard not kept it, for that it made a great accident of the patient. So any topic can be taken, and legally, because always patients are coming and their bills are paid by the third party payers. So third party payer will not accept this nosocomial infections or hospital acquired injuries. They will not pay. So the patient has to pay it from the packet. So how to create the awareness? So the panel discussion is one of the important method. You can very well create the awareness among the hospital members on how our customer has to be treated very well. Otherwise, it will end up our hospital name will be spoiled. And this is the higher level knowledge. Nobody knows what the legal responsibilities are there, how you have to take care. Is it so much important to put a side rails? This is how you have to interact. Once all the session is over and when it's happy, then we are handing over the session to the moderator. Moderator will be given opportunity to the audience to ask the question. You see, this girl is asking question. So the chairperson is not supposed to answer, or the panelist not supposed to answer to the audience. Now Miss Polumi, she is standing there. No, she will take that question and she is giving the session to the chairperson. The chairperson will be giving that question to the expert. Who is the expert? So those experts will be answering to that question.
So the question has to be directed to
how
the
to
moderator.
conduct or
Moderator
organize
will be
in your department. You
directed to the
conduct and
chairperson.
enjoy and
Chairperson
share
will
the
be
knowledge.
telling to the panelist.
Thank you so much
This is
for
how
watching.
the